turabasuhuje. U Rwanda rwatangaje ko Marburg yaranduwe burundu. Ni mu itangazo ryashyizwe ahagaragara na Minisiteri y'Ubuzima kuri uyu wa 20 Ukuboza umwaka w'2024. Ni itangazo twabonye mu Cyongereza, turagerageza kuribashyirira mu Kinyarwanda, kandi ku musozo turaza kurisoma uko ryakabaye mu Cyongereza. Ikinyarwanda riragira riti: Leta y'u Rwanda kuri uyu wa 20 Ukuboza umwaka w'2024 yatangaje ko indwara ya Marburg yaranduwe bidasubirwaho mu gihugu. Ibi bitangajwe nyuma y'iminsi 42 ishize nta bwandu bushya buragaragara, uhereye igihe umurwayi wa nyuma yasezerewe hagendewe ku mabwiriza y'umuryango mpuzamahanga wita ku buzima. Indwara ya Marburg yagaragaye hagati mu kwezi kwa Nzeri 2024, aho abantu 66 aribo bayanduye, hagapfa 15, naho 51 bakabasha kuyikira. Ikindi, hari abarwayi 2 bakize bakuwe ku byuma bifasha guhumeka nyuma yo kwitabwaho n'abaganga. Iyi ikaba ari intambwe ishimishije yatewe mu rwego rw'ubuvuzi. Minisitiri w'Ubuzima Dr. Sabin Nsanzimana yagize ati: iyi ni intambwe ishimishije mu rwego rw'ubuvuzi rusange mu Rwanda. Mu gihe tubabajwe n'abambuwe ubuzima n'iki cyorezo, dusubizwamo imbaraga n'intambwe yatewe. Twabashije kugera ahangaha tubikesheje ubwitange bw'abakora mu rwego rw'ubuvuzi, Guverinoma ndetse n'abafatanyabikorwa bacu. Ubufatanye n'umurava batahwemye kugaragaza no gusenyera umugozi umwe byatumye tubasha guhashya iyi ndwara uko bikwiye. Twabashije kumenya neza inkomoko y'iyi virusi yanduzwa n'inyamaswa, kandi dukomeje kongera imbaraga mu kuyikurikirana. Iyi ndwara ikigaragara, u Rwanda rwahise rwishakamo igisubizo mu kuyikumira. Hashyizweho ahantu hihariye hakora amasaha 28 ku munsi, iminsi 7 mu cyumweru, mu rwego rwo guhuza amakuru bijyanye. Harimo ubugenzuzi, gahunda yo gupima, gukurikirana no kwita ku barwayi, gukingira, guhanahana amakuru no gukorana n'abaturage. Ubufatanye bwa leta, abaganga n'abafatanyabikorwa bwageze ku gikorwa kinoze kandi kigaragara, cyatumye iyi ndwara ibasha guhashywa vuba. Kubasha kwigobotora virusi ya Marburg bishimangira umuhate w'u Rwanda mu kubaka inzego z'ubuzima zihamye no kwerekana ko igihugu cyiteguye gushakira igisubizo mu buryo bwihuse ibindi byaza bitunguranye mu rwego rw'ubuzima. Ni itangazo rero twashyize mu Cyongereza, turaza no kurisoma mu Cyongereza uko riri. Reka turisome mu Cyongereza. Rwanda declares end of Marburg virus disease (MVD) outbreak. Kigali, Friday, 20 December 2024. The government of Rwanda today announced the end of the Marburg virus disease (MVD) outbreak in the country. This declaration comes after 42 consecutive days with no new cases following the discharge of the last confirmed patient, in line with the World Health Organization (WHO) guidelines. The outbreak, which began in mid-September 2024, saw 66 confirmed cases with 15 lives lost and 51 patients recovering. Also, 2 patients were successfully extubated after intensive care, marking a significant step in clinical management of the disease. Minister of Health Dr. Sabin Nsanzimana said, "This is an important milestone for Rwanda's public health system. While we mourn the lives lost, we are encouraged by the progress made. We've reached this point because of the dedication of our healthcare workers, the government, and our partners whose seamless collaboration and swift coordinated action made it possible to contain the outbreak effectively. We've successfully identified the virus's zoonotic origin, and we continue to strengthen our surveillance systems. From the onset of the outbreak, Rwanda swiftly activated its pandemic response. A 24/7 command post was established to coordinate all aspects of the response, including surveillance, testing, case management, vaccination, risk communication, and community engagement. The coordinated effort of government, healthcare workers, and partners ensured an efficient and evidence-based process that brought the outbreak under control in a timely manner. The successful end of the MVD outbreak underscores Rwanda's commitment to building resilient health systems and ensuring the country's preparedness to respond rapidly to future health emergencies. End.